Your Excellency, President of the Republic of Kenya, Your Excellency, Dr. William Samoei Ruto, Your Excellency, the First Lady of the Republic of Kenya, Her Excellency Rachel Ruto, Cabinet Secretary for Health, my brother Aidan Duale, Principal Secretary for Health, my colleague governors, led by our chair of the Council of Governors, the members of Parliament who are present, distinguished guests, ladies and gentlemen, good afternoon. Good afternoon again. It is a profound honor for me to stand here on behalf of the people of Kirinyaga County and to have been recognized as a county that has performed well in this area of maternal health. The guiding policy of our health sector has been clear: to strengthen curative and rehabilitative services, expand comprehensive healthcare in line with the Kenya Essential Package for Health, promote preventive and promotive care, and enhance administrative coordination for effective service delivery. Your Excellency, for the last 9 years, my administration has deliberately invested in healthcare infrastructure, bringing specialized services closer to our people, especially mothers and newborns. Each financial year, we have consistently accounted for 47% of our county budget goes to health, ensuring both facility improvement and human resource development. Your Excellency, as you're aware, we were honored to have you because we completed and operationalized the Keroea Level 5 Hospital, which we were very pleased that you officially opened for us. We equipped a modern maternity wing in that hospital with 80 beds and fully functional newborn unit with a capacity of 60. In addition, we have 4 Level 4 hospitals that we are nearing completion, 2 of which we expect to be done in the next 2 months or so. And with this, we expect to add another 90 maternity beds and 50 newborn units in our Level 4 facilities. In 2017, Kirinyaga had about 50 health facilities. Today, we have grown to 85 health care facilities. On provision of drugs and supplies, we have maintained a steady supply of essential drugs. You will be told by KEMSA that we're one of those counties that never have any debts, outstanding debts with KEMSA. We allocate approximately 600 million shillings a year for drugs alone to ensure all our facilities are running throughout the year. On human resource, Your Excellency, parallel to infrastructure growth, we have strengthened our health care workforce. Recruitment has continued on a need basis. We have increased our technical capacity of medical officers, cutting across the entire medical field. I will not list them because there are quite a number. We have also prioritized staff motivation and recently promoted our consultants and are planning to promote the remaining contract staff that we have and transition them to permanent and pensionable terms coming in this financial year. On community health services, Your Excellency, we know we are partnering with you, and like all other counties, we have engaged 854 community health care promoters, and we have over 115 community health units. In Kirinyaga, Your Excellency, We have our health information system, which connects all our facilities, are integrated and connected using the healthcare information and management system. We're therefore able to share data across all our facilities, monitor all the patients that are coming in, disease prevalence, including the use of facilities. So the impact on these health indicators, Your Excellency, you may be wondering why we're standing here. Antenatal coverage in Kirinyaga has improved from 45% to 63%, which is above 61.3 national standard, and we are working towards the global 87%. Your Excellency, on maternal mortality, we have reduced maternal mortality in Kirinyaga in the years that I've been there from 88 to 55 deaths per 100,000 live births, which is lower than the national average of 355. Kirinyaga is at 88, and we are working with a target of 55 by the end of next financial year. On the live births, Your Excellency, we are even way better than the set SDG target. We are at 20, neonatal mortality has declined from 26 to 10 deaths per 1,000 in Kirinyaga. And we started, when I started, we were 26, now we are at 10, and we want to take it to below 0. The national standard is currently at 21, and the standard that is recommended is 17.2. So you can see Kirinyaga is way below at 10 deaths. On skilled birth attendance, we have risen from 87% to 92% of all the children born in Kirinyaga are assisted by a skilled birth attendants. Immunization coverage, we have increased from 81% to 91%, way above the national average of 80% and the global standard that is recommended of 85%. So we are even above the recommended international standard on immunization. On mother-to-child HIV transmission, we have reduced from 13% to 6.5%, less than the 9.3 national standard average. And the same applies for TB treatment, and our fast antenatal care coverage, Your Excellency, in Kirinyaga, fast antenatal care coverage has risen from 93 to now 98%. So we are very grateful. On the issue of the social health insurance program, Your Excellency, as you're aware, Kirinyaga is currently at 72% of the Kirinyaga population is registered, ranking as 4th nationally, and this we have achieved without any assistance so far, and I have been pleading with the minister, if they came and helped us with our indigents, we'll provide the resources for it. We can register over 80 to 85 or 90% of our staff. Your Excellency, as I conclude, we remain steadfast in investing in infrastructure and equipping our facilities in Kirinyaga. And many people may wonder, but my staff, if you talk to my staff and my healthcare team, they know the emphasis I put specifically on maternal health. Myself, Your Excellency, I was born a premature baby. I was born at 7 months, and I was in an incubator, I'm told, for about almost 2 months in those days, and I barely survived. One of my children, who's my third born, I almost lost my life and his when I was expecting him, because it was an emergency situation where he was born also at just over 7 months. And if there is anything that I take with passion, even in Kirinyaga, and anyone who works for me knows, is the issues of maternal health. And I would want to encourage every mother, even if you're not a mother, every person who has a role to play in public service, whether it is in financial, providing the resources, policy, we urge all our colleagues to put enough investment, there can be no better investment than an investment to a mother, and especially when a mother is bringing life into the world. So, Your Excellency, we are thankful, we support this program, every woman, every newborn, everywhere, and we will work hand in hand with the national government to ensure that it's a success. Asanteni sana.
Thank you so much, and good work there in Kirinyaga. Your Excellency, on behalf of elected members of Parliament, both at the Senate and the National Assembly, and specifically on behalf of the Kenya Women Parliamentary Association, allow me, Your Excellency, to invite Honorable Leah Soipato to make very, very few remarks before we go to the Council